Hello? Can you guys hear me? Hello?
Yes,
Yes,
doctor.
doctor.
Okay. So we are about to start our new topic, that is brainstem, right? So today we will be discussing brainstem. We will also be discussing our CSF and ventricular system. Along with that, we'll be finishing our next topic, that is basal ganglia, right? So all of these things. Okay. Can you guys just see my screen? Hello?
Yes.
Yes,
Okay. Just
yes.
give me a second. Okay. So yesterday we discussed all of the tracks. We discussed cerebral cortex, we discussed the motor cortex, we discussed like sensory cortex and everything, right? So today we are going to discuss brainstem. So can anyone just tell me brainstem is formed by which structures? Which three structures contribute
Mid
info?
medulla.
Okay,
Midbrain,
perfect.
pons, medulla, midbrain.
Midbrain, pons, and medulla. As you guys have seen, you'll be having a lot of MCQs based on like what is present in which structure, right? So that's why we have to emphasize on it. Today we are going to discuss a rule which is known as rule of four. Dr. Margaret, can you just please fix your mic? Thank you so much. Midbrain, right? So we already know that midbrain is derived of mesencephalon, right? So we have mesencephalon, which gives rise to your midbrain, right? Okay, can anyone just tell me the blood supply of midbrain? We already did that. Hello?
Middle cerebral, MCA.
Anterior cerebral.
Okay, it's brainstem. Middle cerebral is present somewhere within your brain, derived of your internal carotid.
Basilar artery.
Okay, basilar, a branch of basilar artery specifically, remember, right? So we discussed the arterial supply, that we have our vertebral and we have basilar, we have our ica, we have pica, then we have superior cerebellar artery, right? So remember, your midbrain is supplied by branches of posterior cerebral artery, the end one, right? The end branch or the terminal branch of your vertebral system was your posterior cerebral artery, right? So some of the branches of posterior cerebral artery and branches of superior cerebral artery basically supplies your midbrain. Is that clear? So branches of posterior cerebral arteries and superior cerebellar arteries. Is that clear?
Yes.
Hello?
Yes.
Okay. Can anyone just tell me the cranial nerves which arises from your midbrain? Yes, you have two of them.
3 and 4.
Okay, perfect. 3 and 4. Okay, can you just tell me, do the cranial nerve 3 decussate or not? Like if you have lesion in cranial nerve 3, would it be ipsilateral or contralateral?
I think only 2 and 4 deficit.
Okay, perfect. So only
Ipsilateral.
2 and 4th cranial nerve decussate. So if we have lesions of 2, 2nd and 3rd cranial nerve, we'll be discussing in detail. Then we are going to have contralateral deficits. While all of the other cranial nerves, arises on the same sides and supply muscles on the same side, right? So that's why if we have any lesion in the nerves other than 2nd and 4th, we'll be having ipsilateral deficits. Is that clear? Okay, we also have another structure present within your midbrain that we'll be discussing in detail, which is known as substantia nigra. Can anyone just tell me what is substantia nigra?
I know it produces dopamine.
Perfect. It would produce dopamine where on your basal ganglia mainly, right? Today we'll be discussing that on your basal ganglia, right? So on the basal ganglia, we have two receptors, D1 receptor on your direct pathway. On your indirect pathway, you have D2 receptor, and normally your substantia nigra. So it basically have two parts, right? Substantial nigra pars compacta and pars reticulata, right? So pars compacta is the compact, like structures of substantia nigra, and compacta is responsible for releasing dopamine. Is that clear? Hello?
Yes, sir.
Okay, so these are the first cranial nerves. Secondly, we have substantia nigra. Thirdly, we have red nucleus. Can anyone just tell me what is red nucleus? Hello, what's the function of red nucleus? Do anyone have any idea? Okay, remember, red nucleus is present within your midbrain, and you have a pathway which is known as rubrospinal pathway. Rubrospinal pathway. So the red nucleus basically is going to give, like motor innervation back to your spinal cord, and this tract, the rubrospinal tract, is important for your which muscles? Flexors muscles or extensor muscles? Yes,
I don't know, sir.
flexor muscles, right? So the flexor muscles of your lower limb mainly are supplied by this rubrospinal pathway. The red nucleus is important in that. It contributes in formation of rubrospinal pathway for the flexors, right? Red nucleus is important. Is that clear?
Yes, sir.
Yes, sir.
Okay, so the fourth structure is medial longitudinal fasciculus. Okay, so today Dr. Mahin just asked you this question. What is medial longitudinal fasciculus? Do anyone have any idea? Yes.
No, doctor.
Okay. That's not that. Okay. For example, let me just give you an example, right? For example, these are my eyes, right? For example, if I want to, if I want you to look at right side, okay? So what happens that your eyes are going to point towards right, like that, right? Okay. So it means that in the right eye, basically you have to stimulate which muscle? Lateral rectus, right?
Yes.
While on the left eye, you have to stimulate your medial
Medial.
rectus, right? It means that if we want to look towards the right or left, so in one eye, we are going to use our lateral rectus, that is cranial nerve 6. And on the other eye, we have to use cranial nerve 3. Is that right?
Yes.
At the same time. So it means that if we are moving eyes at the same time, it means that there must be any connection between the motor nuclei of third and sixth cranial nerve. Does that make sense?
Yes.
Yes, like we have a connection, we have a track which connect your motor nucleuses, right? For example, your third and your sixth nerve nucleus, right? So this connection between these motor nucleuses are simply known as medial longitudinal fasciculus. Is that clear? Why do we call it medial? Because they are present medially within your brainstem. Fasciculus, you already know. It would be in a form of fasciculus, right? Hello?
Yes, sir.
Is that
Yes,
clear
sir.
now? What is medial longitudinal fasciculus? It's a tract simply, or it's a bunch of axon which connects different cranial nerve nuclei with one another, right? So, okay, can you guys just tell me they are myelinated by which cells? Yes. Mylination.
Oligodendrocytes.
Schwann cells?
Oligodendrocytes.
Oligodendrocytes.
Okay, perfect.
Oligodendrocytes.
Oligodendrocytes are going to myelinate it. For example, if we have a demyelinating disease, we have two types of demyelinating disease: multiple sclerosis and Guillain-Barré syndrome. So, what do you think that which demyelinating disorder we are going to see here?
Multiple sclerosis.
Multiple
MS.
sclerosis.
Multiple
Okay,
sclerosis.
perfect. Multiple sclerosis. So, someone having you'll be having a demyelinating disease of the oligodendrocytes. It means that now the connection between your cranial nerve is lost. That's simply known as internuclear hemiplegia. Is that clear?
Hello.
Is that clear?
Yes, sir.
Yes, sir.
Okay. So if we have multiple sclerosis, if you demyelination, so the idea is very clear now. You do not have any connection between your cranial nerve nuclei, right? So let's call it as internuclear. Right?
Doctor, your mic is like.
So simple.
Yeah, you're
Doc, your mic is breaking. We can't hear you clearly.
hear you.
Hello. Hello. Can you guys hear me now? Hello.
We can hear you now.
Okay.
Yeah.
So we were discussing medial longitudinal fasciculus. Oligodendrocytes are going to myelinate it. So multiple sclerosis is going to be affected. So for example, if someone is having multiple sclerosis, you are going to see demyelination of medial longitudinal fasciculus, which is going to lead to, like no connection between cranial nerve nuclei, right? Which is also known as internuclear ophthalmoplegia. Is that clear? Hello? Okay,
Yes.
perfect. And
Yeah.
I already told you that your midbrain, okay, you have your midbrain, your pons, and your medulla, right? So all of these three structures are connected with your cerebellum, right? So midbrain connects to cerebellum via which peduncle?
Superior.
Superior. Huh?
Superior peduncle. Perfect, right? So superior peduncle, you are going to see here. So can I write the fifth structure is going to be your superior peduncle?
Yes.
Okay, perfect. Okay, so this was all about your midbrain. I'm going to discuss a rule that is rule of four. Everything is then going to be so clear. Don't worry, right? Okay, but an important point which you guys must know that on the midbrain, on the dorsal aspect of your midbrain, right? For example, this is your midbrain. On the dorsal aspect of your midbrain, you have like four kind of like outgrowths, like balls like structure present. They are basically known as colliculus, right? So you have superior colliculus and inferior colliculus. Superior, okay, what's the function of superior colliculus? You guys are going to tell me. Yes.
Seeing.
For your vision, right?
Yep.
Okay, which gaze? Horizontal gaze or lateral gaze?
Horizontal gaze.
Horizontal or lateral? Just confirm it. I think it's lateral. What do you guys think? Hello?
I think horizontal.
Okay, so you can just confirm it, right? So superior colliculus, but the main thing which you guys have to know that superior colliculus is important for your vision, while inferior colliculus for your hearing, right? So
Yes,
these were
sir.
the structure. These were the structures which we discussed in our midbrain. Then you have a next structure which is pons, right? We already know that. So let's discuss structure of pons. Before discussing structures, can you guys just tell me the arterial supply?
This is Vaika.
Hidden branches of the basilar artery.
Perfect. So basilar artery, as we discussed, it's going to give small pontine branches, right? So basilar artery is going to supply your pons, and along with that, some branches or the lateral aspect, right? So you have your ventral aspect and the lateral aspect. So laterally, it is basically supplied by ICA, anterior inferior cerebral arteries, right? So laterally, it's supplied by ICA, and medially, it's supplied by basilar artery, right? Can you guys just tell me the cranial nerve present within the pons? Yes.
6 and 7.
6 and 7.
5, 6, 7, 8.
5, 6,
Hmm.
7.
Okay, so that is 5, 6,
6,
7,
7.
and 8. We are going to discuss a rule of 4. Like the idea there is that you have 4 cranial nerves in like above the pons. 2 are present here, like your third and fourth, and 1 and 2 in your cerebrum. You all guys already know that, right? 4 are present within your pons. So the 5, 6, 7, and 8 are present in the pons, right? And 4 are present within your medulla, right? Which one? 9,
10th, 11th,
10, 11, 12.
So
But there is an exception, right? The 8th cranial nerve is very big. So partially it's present within the pons and partially it's present within the medulla, right? So in the medulla, we are also going to consider cranial nerve 8, partial or some small portion. Is that clear? So what's the first rule of 4? You have 4 nerves, cranial nerves within each component of your brain stem, right? So above the midbrain, you have 4, 2 within the midbrain and 2 within your cerebrum, right? Your olfactory and your optic nerve. Is that clear? 4 are present within your pons, 4 are present within the medulla, but the exception is cranial nerve 8, which is big. Partially it's present in the pons and partially it's present in medulla. Is that clear now?
Yes.
Okay, perfect. You have another thing which is present within the pons that is known as reticular activating system. Do anyone knows what is reticular activating system?
Sleep-wake cycle maintains.
Sorry, it maintains sleep and wake cycle, right?
Yeah.
What else?
Alertness.
Okay, alertness, perfect. Okay, let me just give you an example of it. It's going to make everything so easy, right? For example, this is your midbrain. You have your pons, you have your medulla, and then you have your spinal cord, right? Remember, as the tracks are moving up, right? You know, all of the tracks move up here, the spino-cerebral tracks, and the descending tracks move down, right? So whatever gray matter is present within your pons and within your medulla, it's going to be like, you know, divided into pieces. Simply you can think of, right? So you are going to have pieces of gray matter here, right? And why? Because as these tracks are moving upward, it have divided the gray matter. What is gray matter? You know, a bunch of your nuclear
Bodies.
So
or neuron cell bodies, right? Okay,
Yes.
so collectively, this structure is known as reticular activating system. Simple. It's a switch, right? It's a switch. For example, you know, for example, if I want to turn on the light, right? So consider your brain as a light, right? Okay. So for example, it's a bulb, right? And you have a switch, and switches attached like down towards your like into your body, right? So for example, if I want to, you know, like open my brain, right? Like if I want my brain to be like your, to, you know, like to be functioning, if I want my brain to be alert, right? Your conscious brain. So what happens? We have to turn on the switch, right? Is that clear?
Yes.
Hello? Okay.
Yes,
So
sir.
for example, if I want to wake up early in the morning, so my reticular activating system have to be on. Like, or in other words, I have to turn on the switch in order to, you know, enlighten this bulb, right? Or for example, if I want to sleep at night, so what happens? The reticular activating system or the switch have to be closed. So it's a turn on and off switch of your brain. Is that clear?
Yes.
Okay. For example, if this switch is damaged, can I say that it would lead to coma? You can never turn on the bulb. You know, like, or there are some chances of, you know, repair. Like, are you guys getting me? Hello?
Yes, sir.
Like
Yes.
any problem or lesion to reticular endothelial, okay, reticular activating system would lead to coma. That's simple, right? So it's a switch on and off. Again, some parts of your medial longitudinal fasciculus also extend down here into your pons. Is that clear? Because in the pons, we have 5 and 6. 6 for the lateral letters, right? So medial longitudinal fasciculus have to come down into your pons, right? So you have reticular activating system, and you also have medial longitudinal fasciculus, which is present within your pons, right? And it's present medially. Is that clear?
Doc, can you just repeat after the RAS what you said?
Okay. So we discussed that the medial longitudinal fasciculus also, like, you know, extend down into your pons as well. The idea is really simple. What was your medial longitudinal fasciculus? It was connection between your cranial nerve nuclei, that is cranial nerve 3 and cranial nerve 6, right? So if 3 is present within your midbrain, right? Hello?
Yes.
6 is present within the pons, right?
Yes.
So it's obvious that you are going to see this connection or medial longitudinal fasciculus in pons as well. That's so simple.
Okay. Yes.
Is that clear? Okay. Then the last one is your medulla, right? Medulla. So medulla is basically supplied medially by anterior spinal arteries or vertebral arteries, right? So medially, okay, so you have your midbrain, your pons, and your medulla, right? So medially, it's supplied by your spinal arteries. As we already know, the vertebral arteries are going to give, or like anterior spinal artery and 2 posterior. So some of the branches of those spinal arteries, especially the anterior spinal artery, is also going to supply your, like, the medial part of your medulla, while the lateral parts of medulla are being supplied by your pica, posterior inferior cerebral artery. Is that clear?
Yes.
So medially, it's supplied by branches from your anterior spinal artery. You guys already know the blood vessels, which I'm discussing here, right? Spinal artery, and the lateral parts are supplied by pica. Okay, which cranial nerves do we see here? We already know 8 cranial nerve extend to medulla. I already discussed, right? Hello?
Yes.
So you have
Yes, sir.
8,
Yes.
9, 10, 11, 12, and what about area postrema,
Yes.
right? So on the back of medulla, we already know we have a fourth ventricle, which is half present within your pons and half within your medulla. If I just see the posterior aspect of your medulla, you have an area which we already discussed where the blood-brain barrier is broken. That is known as area postrema, which is important for MSs, right? So, for example, if someone is on chemotherapy agent, 5-HT3 serotonin can stimulate this area, which can cause vomiting, right? Hello?
Yes, sir.
And we have inferior cerebral peduncle. Okay, what about the pons? For example, on the posterior aspect of pons, you have an area, right? For example, if this is the posterior aspect of your pons, you have an area which is known as locus coeruleus, right? What do you guys think? Locus coeruleus is important for, yes, what do you guys think?
Norepinephrine. Secretion of norepinephrine.
Secretion of
Norepinephrine.
norepinephrine. Perfect. Norepinephrine, right? So locus coeruleus, you have a UWorld MCQ on that as well. And on the area postrema as well, right? You guys might have already done that. So on the posterior aspect of pons, you have locus coeruleus, which have like adrenergic neurons, which are going to release these norepinephrine. Is that clear? So now let's discuss rule of 4. Rule of 4. In order to memorize each and everything which we discussed, there is a rule which is going to make everything very easy. And if you guys know the rule of 4, you would answer each and every MCQ in your UWorld. Like, for example, where do we have infarction? Where do we have deficit and everything, right? So in the rule of 4, basically we have 4 rules. Rule number 1, rule number 2, rule number 3, and rule number 4. And every rule have further 4 points which you guys have to keep in mind, right? So the rule number 1 we already discussed, right? Above the midbrain, we have 4 cranial nerves arising, right? 2 from your midbrain and 2 in your cerebrum, right? Hello?
Yes.
Yes.
Which 2 in the cerebrum? Cranial nerve 1
1
and 2.
and 2.
Olfactory and optic,
Okay.
right?
Hmm.
Optic pass through which canal?
Optic canal.
Optic canal.
Optic canal. Perfect, right? Okay. And cranial nerve 1 is important for olfaction, right?
Yes.
For
Smell.
example, if you have an individual, he have damage of cribriform plate, which nerve is going to be compromised? Yes.
Olfactory nerve.
Olfactory.
Olfactory, right? Okay, it's related with cribriform plate, like damage, okay? So then you have 2 cranial nerves which are coming from your midbrain. Yes, which cranial nerve? 3 and 4, right?
4.
Yes.
Oculomotor and
Oculomotor
trochlear.
and trochlear.
Perfect. Oculomotor is going to supply which muscles? Your medial rectus.
Mm.
Yes, inferior rectus. What else? Inferior oblique, right?
And superior rectus. Yes.
Superior rectus. Okay, your superior rectus as well. And what about cranial nerve 4? It would supply your superior oblique, right?
Yes.
What's the function of medial rectus? We already know, abduction. Can I write that?
Yeah.
What's the function of inferior rectus?
Internal rotation.
Sorry?
Internal rotation, yeah.
Inferior rectus, internal rotation or depression?
Depression.
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 What about inferior oblique?
Superior rotation.
Distortion.
Yes.
Okay,
Extortion.
extorsion and yes,
And elevation.
and elevation.
Elevations.
Yes, what do you guys think?
Elevation.
Or if I'm just looking down, like laterally abducted, so for that we have inferior oblique. Like for example, okay, looking down or looking up?
Looking up.
Looking up.
Looking up. Okay, up. For example, if I'm climbing, or like let's suppose if I'm just like climbing the stairs, right? So inferior oblique is responsible for that. What about superior rectus?
It moved the
When
eye.
I down,
Looking down. Looking down. Oh, sorry. Superior actors looking
Superior
up.
rectus, not oblique.
It's
Yeah,
up.
looking.
Elevation.
Looking up.
Elevation. Okay. What about superior oblique? We discussed one of an MCQ. That is looking down when adducted, right?
And in, yeah. So that's why it helps in
And-
reading and
And intorsion, right?
Mm.
Is that clear?
Mm.
Okay, so this was all about rule of 4. We discussed the first rule. Let's discuss the second rule. Okay, no, we haven't completed. Okay, so the the first rule of 4 states that you have 4 cranial nerve above your midbrain, and in the midbrain you have 2. What about the pons? We already discussed. We have 4 cranial nerves in the pons as well. That is
Yeah.
and
5,
Yeah.
6, 7, and 8.
And
What about medulla?
It's 8,
9,
9, 11, 12.
10
11,
and 12.
and 12. But 8 is big. So let me just write it down. 8 as well, partial or half a portion of your 8 cranial nerve. Is that clear?
Mm-hmm.
Yes.
Okay, what's the function of cranial nerve 5? Let's discuss it here. What's the name of cranial nerve 5? What do we call it?
Trigeminal.
Trigeminal. Perfect. It means it have 3
Branch.
division or branches. Branch 1, branch 2, branch 3. What's the name of branch 1? V1.
Ophthalmic.
Ophthalmic.
Maxillary mandibular.
Ophthalmic,
Maxillary and mandibular. Yeah.
maxillary, and
Mandibular.
mandibular, right?
V1,
Okay.
V2, V3.
V2 and V3. Okay, through which foramen do ophthalmic division moves?
Superior
Superior
orbital.
orbital.
Orbital fissure.
Orbital fissure.
Okay, superior orbital fissure. Okay, and in respect to your cavernous sinus, can I say it's present laterally in your cavernous sinus? Yes or no? Am I right
Yes.
or wrong?
Yes.
Okay, so it's present at the lateral aspect of your cavernous sinus. And yesterday we discussed, what about cranial nerve 6? It is in close
Medially.
proximity or in the middle of your cavernous sinus, just below your internal carotid, right? So for example, if you have internal carotid aneurysm, it would
Aneurysm.
compress your abducent
Cranial
nerve, right?
Yeah.
Okay, perfect. Okay, superior orbital fissure. What about maxillary? Okay, through which foramen?
Rotundum.
Rotundum.
Rotundum. Then it would just move and exit through which other foramen? You have another foramen
Inferior
which
orbital, I think.
inferior
Orbital.
orbital
Foramen.
canal, right? It's a canal.
Mhm.
Yeah.
Okay. And what would it supply?
Upper
It was
lip.
uh,
Jaw.
Cheek. Mastication.
The maxilla. So, yeah.
Okay, the maxillary portion, right? And it's sensory in nature, right?
Mhm.
Yeah.
Okay, perfect. What about mandibular? Can you just tell me the foramen?
Ovale.
Oval.
Ovale.
Okay. And then it have a branch which is inferior alveolar.
Yes, supplying the lower lips and jaw.
Okay, so you have a branch inferior alveolar. It would come through mental foramen,
Mental.
and it would just
foramen.
supply your lower lip, chin, and your lower teeth, I guess, right?
Yeah.
Yes.
And some teeth. Okay. Okay. So mandibular also supplies the muscles of mastications, right?
Yes.
Yeah.
Yeah.
Okay, muscles of mastication. What are your muscles of mastication? Your masseter,
Masseter.
Medial
Tem-
lateral pterygoid.
temporalis,
Temporalis.
and
Pterygoids.
medial and lateral
Pterygoid.
pterygoid, right? For the opening of jaw, which muscle is important?
Pterygoid.
The only one muscle which open your jaw. Open your mouth. Hello.
And lateral
it's one of
pterygoid.
the
Lateral pterygoid.
Pterygoid.
Lateral pterygoid. Okay, it's very high yield. You guys have to know that. Lateral pterygoid. Okay. So, okay, what about the? Okay, so, okay, what's the other function of mandibular nerve? We have missed something? Yes. In the tongue. Did mandibular nerve do something or not? Okay, what taste or general sensation?
Sensation.
General
Okay,
sensation.
general sensation from
Anterior.
anterior two-third of your tongue. Is that clear?
Muscle of ear, internal ear.
Okay, muscle. Okay, which muscle? Yes.
Tensor tympani.
Stapedius is just supplied by your facial nerve.
Tensor tympani. Tensor tympani.
Tensor tympani, right? Tensor tympani was also supplied by branches of mandibular nerve. Is that clear? Hello?
Yeah.
Hello?
Yes.
Yes.
Oh, okay, perfect, right? So let's discuss the second rule of 4. So the second
Doc,
rule
can you just
state, yes,
Doc,
please.
can you just repeat about what you said about the V1, like its association with the cavernous sinus and the superior orbital fissure? And
Okay, so actually the V1, or simply you can imagine all of you, like you have cavernous sinus, right? So in the cavernous sinus, in the middle, you have your internal carotid, right? So in close proximity to internal carotid, you have abducent nerve, right? But in the lateral valve, you have which nerves? All of like cranial nerve 3, 4, 6, and the ophthalmic branch. And along with that, what else? Yes. Hello?
mm,
The vein.
One of the
Maxillary
branches.
branch.
Auxiliary
V1.
branch.
Okay. So the idea is that, for example, if someone is having cavernous sinus thrombosis, if the entire sinus is involved, then all of these nerves are also going to be affected, right? But if you have aneurysm would only affect your cranial nerve 6. You have a U-word MCQ on both of these points. Is that clear?
okay.
Is that clear?
So, like,
Hello?
if there is aneurysm, then only
Again,
6 will be affected, right?
if we have aneurysm, it would be only limited to cranial nerve 6. But if you have thrombosis of the entire cavernous sinus, then these lateral, the nerves which are present at the lateral aspect of your cavernous sinus are also going to be involved. Is that clear?
Okay, yeah.
Okay, perfect. So what's the second point? The second point states that, so you have 12 cranial nerves we discussed. So any cranial nerve which is divisible by the 12th number, they would be present medial, in the medial aspect, right? So for example, we have cranial nerve. Okay, just skip cranial nerve 1 and 2. Start from 3. Is 3 divisible on the 12th? Yes or no?
Yes.
Is 4 divisible on 12th?
Yes.
Yeah.
Yes.
Is 5 divisible?
No.
No.
6?
Yes.
What about 7?
No.
No. 12.
What about 8?
No.
9?
No.
10?
No.
11 and 12. Okay. So we can see only 3 is divisible, 4 divisible, 6 divisible, and 12 divisible. It means all of these cranial nerves are present in the medial aspect, right? So cranial nerve 3 is present in the medial aspect of your midbrain, 4 is present in the medial aspect of your midbrain, 6 is present medially, and 12 is present medially. All of the other are present laterally. Is that clear now?
Yes.
Okay, perfect. So this was the second rule. Let's discuss the third rule. Third rule states that whatever structure starts with the word M, they would be present medially, right? Medially within the brainstem. What are the 4 structures which are present medially? We start with the word M. You already guys know that, right? Medial longitudinal fasciculus.
Yes.
It's present in the medial aspect of your midbrain and pons, right?
Yes.
Yes.
Okay, what about the motor pathway? Descending pathway.
Yes. Medial as well.
Okay, perfect. What about the medial lemniscus system? Do you remember? Dorsal column, medial lemniscus. What about medial lemniscus? It's also
It's
present medially. Is that clear?
Yes.
Okay, and what about motor nuclei of cranial nerves? So cranial nerves have motor nuclei. Third cranial nerve, fourth, fifth also have motor component. You have your 6 also have motor component abducent. Your 7 is motor, your 9, 10, 11, and 12. They have motor components. And all of the motor nuclei of these cranial nerves are also present in the medial aspect, right? Motor nuclei. Is that clear?
Yes.
So we, in the rule of 4, again, we have 4 things which are present medially, right? Hello?
Yes.
Hello? What about the last rule? The last rule of 4 states that whatever start with the word S would be present laterally, right? Okay. So can you guys just tell me what start with the word S? We have spinothalamic pathway, right? Spinothalamic, remember?
Pain
From the
temperature.
spine into thalamus. The ascending pathway that was present laterally, right? So the spinothalamic pathway, the spinothalamic pathway is present laterally within the brainstem. I don't know what happened to my pencil. So let's discuss it. I think the charge is going to let me just charge it for 1 minute. What else? The sensory nuclei of cranial nerve 5, trigeminal. It's also present in the lateral aspect. Is that clear?
Yes.
Yes.
What about spinocerebellar tracts? From the spinal cord into cerebellum, which was ipsilaterally. Remember, anterior and posterior. Remember? They are also present laterally. And the last one is sympathetic pathway, right? Which is coming from your hypothalamus. We already know that, right? It is also present laterally within the brainstem, right? So you have spinothalamic, you have sensory. Okay, what happens to my pencil? Okay, you have sensory nuclei of cranial nerve 5, right? We have sympathetic pathway and
Cerebrum.
cerebellar, right? So all of these pathways, they are present laterally. So if you guys know the rule of 4, each and every MCQ is going to be so easy for you guys. Like in the U world, they'll be asking you that we have compromise of this nerve, this, that. If you guys know the rule of 4, you can answer each and everything. You guys already know the blood supply. You guys know each and everything, right? So can anyone just give me an overview till that my pencil will be like, a little bit charged, so I will just continue with the other topics. Yes. Can anyone just give me? Okay, yes, Dr. Amis, please.
Okay, so from where do you want
I
me to
want
give
you
the
to
overview?
give, yes, from rule of 4s. Just start with rule of 4.
Okay, so like for the structures of the brain stem, we
Can
just
you share
follow
the
the rule.
screen, Dr. Ahmad, please?
Okay, I've already shared the screen. Okay, let me just, okay, just give me a second. Yes.
Yeah. So like the for the structures of the brain stem, we generally follow the rule of 4. So for the first rule, it says that there are 4 cranial nerves like above the pons, level of pons. That means
Okay.
there are 2 cranial nerves in the cerebrum and the 2 cranial nerves in the brain stem. Now, for the first 2 cranial nerves, which arises from the brain cerebrum, they are cranial nerve 1, which exists from the cribriform plate, and cranial nerve 2, which arises from the exists from the optic canal. And now for cranial nerve 3 and 4, it arises from the midbrain. So cranial nerve 3, it gives it is oculomotor nerve, so it supplies the uh, now 4 nerves of the 4 muscles of the eyes, that is medial rectus, inferior rectus, superior rectus, and superior oblique. And we talked about the different movements that is caused by the stimulation of those muscles. Like medial rectus cause the medial deviation of the eye, inferior rectus cause the depression of the eye, superior rectus cause the upward movement of the eye, and superior oblique causes the downward and inward movement of the eye, and also intorsion.
Okay.
Right.
Yes, perfect.
Okay. Now also for the cranial nerve 4, it supplies the let's see, yeah, it supplies the superior oblique, I think.
Okay.
Cranial nerve 4,
Yes.
yeah.
For superior oblique, just simply think, for example, if you're just moving downstairs, superior oblique is responsible for that. Because if you are just moving downstairs, we need to look down and along with that adduction, right? And if you just want to look up, so abduction and like move or looking up, that is for inferior rectus cranial nerve 3. Is that clear?
Yeah, yeah. Okay.
Okay.
Okay, now there are four cranial nerves in pons. That is 5, 6, 7, 8. Now we talked about a little bit about cranial nerve 5. It is trigeminal nerve. It is composed of three divisions. That is V1, V2, and V3. And This cranial nerve passes laterally uh, laterally to the cavernous sinus. So if there is like thrombosis, then these nerves can get affected. But in cavernous sinus, since abducens nerve is medially located, so if there is only any aneurysm, then only abducens nerve will be affected. But all the nerves that are running laterally to the cavernous sinus will be spared.
Okay.
Okay, and then V1 passes through the superior orbital fissure. And now talking about the V2, it passes through the rotundum foramen and it passes through the inferior orbital canal, and it supplies to the sensory innervation to the maxillary area. And
Okay. You have a UL
now,
MCQ
now
here.
for
As remember, we have an individual with a mole-like thing present on the upper, so which nerve is responsible for that maxillary? Remember?
yeah, I have not done that.
Okay.
Okay. Yeah. And for the V3, it passes through the foramen ovale, and then it passes through the mental foramen, and it gives a branch which is called inferior alveolar branch, which supplies sensory innervation to the lower lip and teeth. I guess. Okay, and it also supplies the muscles of mastication, that is
Your voice is
masseter
breaking.
temporalis.
Dr. Ramesh, your voice is breaking.
Okay, can you hear me
Hello?
now?
Yes, yes, we
Can you
can
hear
hear
me
you
now,
now.
doctor?
Yes.
Yeah. So the inferior alveolar branch or the V3 supplies the motor innervation to masseter temporalis, medial pterygoid, and the lateral pterygoid. Among them, only lateral pterygoid helps in the opening of the mouth, and other three muscles are like associated with the closing of the mouth. And also, V3 is responsible for the general sensation of the anterior two-thirds of the tongue, and it also supplies to the tensor tympani muscle.
Okay.
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 Yeah.
Okay.
Okay. And
Perfect.
for there are four cranial nerves in the medulla also, that is 9, 10, 11, 12, but 8 being a big nerve, a big nucleus, so it also spans in both in pons and the medulla. Can you hear me, doctor?
The third and the yes.
Can you please repeat this?
Hello. Can you hear me?
Yes, yes, we can
Yes,
hear
we
you.
can hear you.
Yes, we can hear you.
Okay. 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 And for now,
Yeah.
the second rule of that is rule of 4. It says that all those numbers that are divisible by 12, that is 3, 4, 3, 4, 6, and 12. That is, there are factors of 12. So these structures are present medially and remaining are present laterally. And the third rule of 4 is that the structures that starts with the letter M is present medially. Uh, that is the medial longitudinal fasciculus (MLF), the motor pathway, that is the descending pathway, medial lemniscus, that is dorsal column medial lemniscus pathway. Though the medial lemniscus is an ascending pathway, it will also be medially
Your
located,
voice,
and the motor component of the cranial
your
nerves will
voice
also
is.
be located medially. Hello.
Hello,
Can
Dr.
you?
Ramesh. Hello, can you hear me?
So there's some issue from your side.
Okay, it's problem from my side, right?
We c-
Yes, sir.
Yes.
yes,
Hello?
sir.
His voice is good.
Okay, just give me a second. Let me.
Okay, thanks. Okay. Thank you, Dr. Alma. And I will just complete the last rule of 4. it says that the structures that start with the letter S is will be present laterally. That is the spinothalamic pathway, which is an ascending pathway, and the sensory nucleus of the cranial nerve 5, and also the spine.
Hello, can you guys hear me? Hello? Hello?
Yes, sir.
Okay. So let's discuss our next topic, that is CSF, cerebrospinal fluid. Can you guys hear me perfectly? I think there is some problem in my connection. Is that clear? Hello?
Yes, we can
Yes,
hear
Hello?
you, sir.
here.
Yes, doctor, we can hear
Okay,
you.
One question, sir.
cerebrospinal fluid, right? So this is going to be our next topic. So what is cerebrospinal fluid? We already know that our central nervous system is surrounded by a fluid which is known as cerebrospinal fluid. It have a lot of function. We'll be discussing that in detail. What's the function of cerebrospinal fluid? Basically, it's going to provide the cushioning effect. It's going to decrease the weight of your central nervous system in order to avoid, like herniation through your foramen magnum. We'll be discussing that, right? But before discussing what's the function of cerebrospinal fluid, the question should arise that what structures contribute in formation of your cerebrospinal fluid? Remember, we have hollow cavities within our central nervous system. We already discussed that, right? Those are known as ventricles, right? Hello?
Yes, sir.
Yes, sir.
Yes, yes.
Hello?
Yes, we hear you.
Yes, sir, we
Yes.
can hear you.
Can you guys hear me? Hello?
Yes, yes.
We can hear you.
Yes.
Okay.
Yes, sir.
So we have hollow cavities within your central nervous system. Those are known as ventricles, right? So we have two hollow cavities within the telencephalon, which are known as your lateral ventricles, right? Or in your cerebral hemispheres. Those two lateral ventricles are connected. In the diencephalon, you have a third hollow structure or a ventricle, which is known as third ventricle, right? So like in the telencephalon or your cerebral hemisphere, you have an hollow structures. Those are known as ventricles, and here their specific name is lateral ventricles, right? Within your cerebral hemisphere, lateral ventricles. Lateral ventricles are attached, like all of the cerebrospinal fluid are going to be made within the lateral ventricles. We are going to discuss that, right? So, how are the cerebrospinal fluid, made, right? So the ventricles are lined by special cells. Remember, those are known as ependymal cells, right? Ependymal cells, which covers the inner surface of all of your ventricles, right? So what happens that the blood supply is, like for example, if you have a blood vessel which is surrounding these ventricles, so these blood vessels is going to go into the ventricles. Like let me just like zoom in the picture. For example, if this is your ventricle, so the blood supply or the blood vessel is going to go into the ventricles. It's going to be surrounded by, okay, so this is your blood supply, right? Or the blood vessel. So as it pierces into the ventricles, it would just drag the pia mater along with itself. So on the surface of this blood vessel, we are going to have pia mater, and surrounding the pia mater, the ependymal cells are also going to be dragged, right? So this structure is going to be formed as the blood vessel enters the ventricle. And collectively, this structure is known as choroid plexus. Is that clear?
Yes.
Okay.
Yes.
So choroid plexus are like, the main structures which form your cerebrospinal fluid. So how would choroid plexus form cerebrospinal fluid? Remember that choroid plexus would, dump some Na through your ATP channel. So Na is going to come into this hollow structure. Na plus, right? Are you guys getting me? Hello?
Yes, sir.
Can you
Okay.
repeat the
As
last?
Na is... Sorry?
Can you repeat this part? So, this is from the red one.
Okay. We were discussing that the blood vessel is going to enter into your ventricles, right? As it enters into the ventricles, it would just drag the pia mater, and the pia mater is going to cover the surface of that blood vessel, right? And ependymal cells upon that will also be present, right? So collectively, these structures are known as choroid plexus. So what choroid plexus are going to do next? It's going to actively pump out your Na. As Na is positively charged, so the cell is also going to move, right? So you'll be having an NaCl or a salt, right? And NaCl is osmotically active substance, we already know. So it would pull all of the water from these plexus, H2O, right? So now we have NaCl and H2O within your ventricles, right? What would happen next? That these choroid plexus have certain, pumps or channels for glucose as well, right? So it would dump some glucose as well, right? And along with the glucose, it would also pump some K plus, remember. And collectively, all of this, this cocktail which is formed is your cerebrospinal fluid. Is that clear?
Yep.
Hello? Okay. So let me just revise it again. First of all, your choroid plexus are actively going to pump your Na. Cl is going to follow. You're going to have NaCl. NaCl are osmotically active. It's going to pull all of the water from the plexus. And along with that, glucose is also going to be actively pumped and K plus. Collectively, it's your cerebrospinal fluid, right? So as the cerebrospinal fluid just come out here, it would move into your third ventricle, which is present within your diencephalon, right? Through this foramen. And what's the name of this foramen? Yes. Hello?
Interventricular foramen.
Lushka.
Okay.
Yeah.
Foramen of Monro.
Foramen of Monroe.
It's Monro, right? So this cerebrospinal fluid is going to enter into the foramen of Monro, into your third ventricle, and then it's going to come down, right? So in the midbrain, you have your cerebral aqueduct, right? Cerebral aqueduct, through which your CSF is going to flow, right? And as it just come down here, like you have, okay, for example, this is your midbrain, your pons, and your medulla, right? And you have your cerebellum here. So you have cerebral aqueduct. The CSF is going to, follow the cerebral aqueduct, and here it's going to drain into a fourth ventricle, right? You have a ventricle which is known as fourth ventricle. So half of this fourth ventricle is present within your, within your medulla. Half is present within the pons, and like that, you are going to have fourth ventricle, right? And from the fourth ventricle, cerebrospinal fluid is going to go into your spinal canal, right? In between your spinal cord. Is that clear?
Yep.
Okay. So you have two foramens. Okay. Basically, you have three foramens within your fourth ventricles. Two are present laterally and one medially at the posterior aspect. Is that clear? What's the name of these lateral two foramens?
Lushka.
Lushkas. Okay, so you have foramen of Lushka. Perfect. And this posterior medial foramen, this is known as your foramen of Magendie. Perfect. So these foramen would drain all of the CSF into subarachnoid space. You guys already know that CSF is present within your subarachnoid space. Is that clear? Hello?
Yes.
Yes, sir.
As this CSF is, come to subarachnoid space, it would just occupy all of your spinal cord as well. And you have your subarachnoid space, which is surrounding your brain. You guys already know that, right? So all of the CSF is going to go like that. And ultimately, it's going to move upward. You guys already know, right, that we have dura mater. Dura mater have two layers, your periosteal layer and what else? Hello?
Dura.
What are the two layers?
Yeah.
It's PM
Perennial and meningeal.
and subarachnoid.
Perennial and meningeal.
And
Periosteal.
meningeal.
Periosteal and
Okay, periosteal and meningeal layer, right?
Meningeal.
So for example, this is your brain, right? It's going to be, it's going to be like lined by your dura mater, and dura mater here is going to be split into a structure like that. For example, if this is your brain from the lateral aspect, right? So you have a sinus which is known as superior sagittal sinus, right? It's a triangular kind of sinus. So what happens that all of this CSF which was coming into your subarachnoid space surrounding your spinal cord, and ultimately it's going to come here and it's going to drain into superior sagittal sinus, right? Through a finger-like projection which are known as arachnoid villi. Is that clear? Are you guys just getting me?
Yes.
Okay. From the arachnoid villi, as it drains into the sinus, into superior sagittal sinus, furtherly it's going to drain into occipital sinus, your sigmoid sinus, and ultimately where? Internal jugular vein, right?
Yes.
internal jugular vein. Let me just give you an overview again, right? So we discussed we have CSF. There are a lot of function of CSF. How CSF is formed? Through it's basically made by your choroid plexus. Once it's made within the lateral ventricles, within the third ventricles, it's going to go through the foramen of Monro into your third ventricle. Then it's going to come down through cerebral aqueduct, which is present in your midbrain, right? And then it will drain into fourth ventricle. Fourth ventricle have lateral two foramens, which are known as foramen of Luschka, and posterior medial foramen, which is known as foramen magendi, right? So it would drain all of the CSF into subarachnoid space. It would just, revolve all around your CNS, and ultimately is going to move up into superior sagittal sinus, right? So superior sagittal sinus is basically made by the meningeal and periosteal layer of your dura mater, right? Once all of the CSF is drained into superior sagittal sinus through arachnoid villi, finger-like projection, which are one valve, it's only going to drain CSF into your superior sagittal sinus. From the sagittal sinus, CSF do not come back. So it means it's one valve system, right? So from the superior sagittal sinus, it would move through your sigmoid sinus into internal jugular vein. That's the entire pathway of CSF. Is that clear? Hello?
Yes. Yes, sir.
Okay. So the CSF is very important, right? So as you know that it's surrounding all of your central nervous system. So it would provide cushioning effect. Like for example, if you have some trauma, so it would act as a shock absorber, right? It would absorb all of the shocks. Okay. And another point which you guys have to keep in mind that, like whenever you have the brain is present within the fluid, CSF, right? And whenever anything is present within the fluid, so there is a force which is known as buoyant force, right? Buoyancy, right? So this fluid would basically decrease if the brain is present within the fluid, the mass or the weight of the brain or your CNS is going to be less in the fluids, right? Like the example for that is like you can easily pull a ship within water, right? But you cannot pull it on the ground. Why? Due to that buoyancy force, which is provided by the liquid. Is that clear? Hello?
Yes.
Are you
Can
guys
you
just
repeat
getting
it?
me?
No,
Yes,
no.
sir.
Can you
Okay,
read
so
last point?
as we discussed that this is your CNS, right? Your brain and spinal cord. It's surrounded by fluid, CSF, right? So the CSF is going to decrease the weight of your CNS. Why? The example for that is if I just tell you to, drag a ship on the ground, so it's very difficult. But if I just tell you to drag fish within water, your ship, right? Within water, so you can easily drag that, right? Because the water provide a buoyant force, which decrease the weight of a ship, and you can easily drag it, right? So same is the example with CNS, as it is surrounded by CSF. So the weight of your central nervous system, whenever it's present within the CSF, is going to be very less. And that's very important. Why? Because if we drain out the CSF, what happens now? The weight of your CNS is going to be very more, and it would start herniating down through foramen magnum. And you can pull all of the nerves, which can cause problems, right? Hello?
Yes. Yes, sir.
Yes, sir.
Okay, right. And another thing which you have to keep in mind that CSF also is important for transport of different hormones. For example, melatonin from one side from one side to another side, right? So it's very important for the transport purposes, right? Of different things. Like it's also going to nourish your CNS. So it's very more important, right? So that was all about today's lecture. I think that many of the students are leaving. I think they're bored or they're understanding. I don't know why. So let's stop our lectures for today, and we'll continue tomorrow. Before finishing the lecture, so anyone who can just give me an overview of this topic. Hello. Okay, Dr. Ramesh, are you guys just enjoying the lectures? Why am I seeing
Yes,
so less
doctor.
people?
Yes.
I think we are making CNS like neurology so easy, but we have very less participants.
Yeah. But we are enjoying the lecture. Yeah.
Okay, so yes, Dr. Ramesh, can you just tell us about the CSF?
Okay. So CSA helps in providing a cushioning effect to the brain, and also it provides buoyancy force for which the brain feels light. So if it is lost, then